Yeah, and a couple of the documents that John put up on the website, couldn't copy them because they're just too lengthy, but like one of them is from the Department of Developmental Services. It's school days to work days, and I actually think it's a great document that sort of explains the whole process of moving from school services onto adult services. And it's definitely something that you want to take the time to read it at your leisure, sort of digest it, go back and look, because it is pretty substantial and it's a complex process. So the handout that I put together is just 12 pages, and it's a bunch of different things. And really what it was to do is not to provide the framework for any specific discussion, but to give you different resources for you to be able to access. Like it talks about when your child's turning 18, you need to know that the decision-making process is going to transfer to your child. At your IEP meeting, your child can delegate in writing decision-making to you for purposes of the IEP. And you can do that with the team present. There's a specific form for that your special ed coordinator can provide for you, so that if you haven't looked at the issue of guardianship yet or the power of attorney, you can have your child delegate decision-making to you at your team meeting. So for IEP purposes, that will be taken care of right then, okay? Now, whether or not your child has the capacity to do that is a separate issue for you to take a look at. Also, with regard to sort of going on to adult life, you know, you have to look at what is the 688 referral process. And the district can make a referral, 688 referral, and they should be doing that, but you can also do it yourself. You don't have to wait for them. You know, myself, I know that my daughter is, you know, the Department of Mental Retardation is now called the Department of Developmental Services. So my daughter's been enrolled there since she was 6 years old. So she's already in the queue, that they know that Mary Kain has, you know, disabilities and she's qualified for DDS. So she's in the queue, that they know that she's coming up. She's going to be turning 22, thankfully not for another 6 years, but she's already in the queue. So look at what services does your child currently have with other agencies. Does your child get MassHealth? For MassHealth, you can get services through MassHealth for adult services. Now, these are the more impacted population that I'm talking about, but also with regard to DDS, they provide support, community-based day support, which is support in the workplace, support to do like volunteerism, jobs, things of that nature. MassHealth is more of a day hab situation where it's more like working on functional skills, like daily living skills, social communication, things of that nature. MassHealth won't pay for, you know, things out in the community, going to jobs and doing things like that. But look at the agencies that you're already connected with. Maybe you're connected with the Department of Mental Health. See what it is that they have in line for adult services, because the big difference is that at age 22 or when your child graduates, if they're younger, IEP services go away and there is no entitlement to adult services. Adult services are a benefit. There's no entitlement to them. So you want to get in line, because it's one of those issues of there's a lot of people in line, and once they run out of resources, then it's sorry, and the budget goes up and down every year. So you want to get your child in line and, you know, be in contact with case managers and get part of that referral process going, so that when your child does turn 22 or they graduate from school but they need more support, they're going to have a safety net. They're not going to just drop into an abyss and have nothing. So this is really an effort to say, how do you get prepared beyond BPS, but also what are other things that are available beyond BPS? So one of the things, and there's different resources listed on here, people can decide for them. It's been around for a few years, but, you know, all right, so for 2011 is the ARICA law. If you have a child on the autism spectrum, the issue of ABA services, but also evaluations for those services, those can now be covered by private insurance. In fact, it's mandated except for certain types of insurance policies. MassHealth is excluded from the ARICA law. Okay, but there's new legislation that was passed in Massachusetts that will get MassHealth recipients coverage for ABA services, but it's pending federal approval right now. Right, Joanne? Is that correct? So
like that Cross, what about Blue Cross Blue Shield?
Then you have to talk to your specific insurance provider and ask what coverage that you have. But the law is specific about the types of coverage, and then you have to look at what your policy is. Like some that are federally funded aren't necessarily, there's exclusions that apply. So you want to call your insurance company. But this is the first time that services for things like ABA services, which children on the autism spectrum need a lot of, are now being covered by private insurance. And not just the ABA services, but also the psychological exams. Sorry, I just got braces today, so I'm having a hard time talking. Is that, you know, different things in treatments, also PT, OT, speech, things of that nature are now being covered more broadly by insurance, and it's specifically for kids on the spectrum. So that's one of the things you want to look at. Do I have more coverage now than I didn't have? Or if I have MassHealth, what's the status of the MassHealth approval? Maybe it's going to go. In addition to that, if you only have MassHealth, there's called the Premium Assistance Program, where you contact MassHealth, you can sign up, you can get private insurance, and MassHealth will pay the premium. Like if you just have MassHealth and you could get Blue Cross, say through your employer or something, MassHealth will pay the premium cost that you would pay every week for your Blue Cross, because they want you to have Blue Cross and not just MassHealth. So you get a check for what you pay for your insurance from MassHealth to have that other insurance, but it has to be available to you. So that's another thing that you want to look into. Is that something else that I can get? Because
I got MassHealth and Medicare.
okay, MassHealth and Medicare is sort of the same thing, one's federal, one's state. So both of those are issues where the ERISA law doesn't apply right now, and there's special legislation pending for that. Okay?
Can I ask something?
Yep.
So, the ARICA law only applies to children, not adults who are on the autism spectrum.
No, there's no, read the materials that I gave you. My understanding is that there is no age limit. Okay? But what applies to the person for coverage as an adult versus as a child under your policy, those are also things you need to look at. But, you know, with regard to kids with disabilities, everybody needs to look at their own policy, because they're all different, they're all over the place. I can't say that one rule fits all, because even within the same, like Blue Cross, there's probably 5 different plans, and they have different exclusions in different plans. But that's why I have the 1-800 number on your card. If that's what you have, you call up and you say, what is the coverage, what is this? And this is how a lot of families across Massachusetts are now accessing additional resources. And you're paying for them through your premium, so you want to access as much as you can out of your insurance, especially while kids are young, because it does have the most impact to get them to more independence in life. Okay, so, but once the adult thing is a little bit tricky, but one of the things that was mentioned briefly, that I don't have a lot of information on at this meeting, but as I get more of it, we'll put it up on the website, is adult foster care. So, you know, Dawn was talking about having co-guardianship. Look at the issue of adult foster care too, because you can have 2 parents in the home. One of them can have guardianship and the other one can be the adult foster care parent. The issue is that the person's not left alone for a certain number of hours a day. If your child qualifies, then you get a direct check for taking care of that child during those additional hours. So there's, you know, these resources are meant to be out there for disabled individuals who need them. What we need to do is help parents access the appropriate resources that are available to our kids, whether they're young, they're, you know, teenagers, and even when they become an adult. So that's really what this workshop is trying to say. There's other services beyond BPS. The services in BPS, yes, your child's entitled to them from age 3 up to 22, but life goes on after 22. And even during the time that you're in BPS, if you can be accessing other resources for the benefit of your child, then you want to do that. You know, one of the things that I have for my child is it was called a DOE DMR intervention plan, which was to say, it's basically a prevention plan to, if you think your child might be someone that will eventually have to go into a residential setting because their needs are so great, then basically you get extra funding to prevent that from happening, that will pay for additional services for your child from the age 6 up. But this is another one of those services that you gotta get in line to get it. Unfortunately, that program has been cut across the years, so there's really not a lot of plans being offered, but the program is still funded. So if your child is registered with DDS, what you want to call and say is there any additional funding available to my child, whether or not they have an actual plan? Because every year when they go through the fiscal reconciliation, and the fiscal year runs from July 1 to July 1, so especially in June, there's money that's been untapped. If parents have receipts for things they bought their children, specialized equipment, they've paid the services, a lot of that, if there's additional funding, you can get reimbursed for it. But your child has to be registered with the agency. So if your child's not registered, get them registered. If you think that they qualify, they'll do their own evaluation, they'll let you know. And it doesn't cost anything. So those are the services you want to take advantage of. It's the ones that don't cost anything to get a hold of for your child. If your child has MassHealth and your child has issues with independent functioning, do you get PCA services, personal care attendant? Someone will come in and evaluate your child. They'll look at what their needs are. Do they need help with dressing, with toileting, with feeding, showering, all of those things. And as they get older, there's a broader range of things that your child, sort of what would your child be expected to be able to do at a certain age level that they're clearly not able to do, and so they need somebody's assistance to do that. You'll get hours for that. If your child needs nursing, because maybe they have a seizure disorder or some significant medical issue, you can also get nursing hours through MassHealth. So these are all things that you want to explore, because it's not, if you have an IEP, then you don't get them. They're all separate. All of our agencies run their own silos, and what you want to say is, am I hitting every box that my kid is eligible for to make sure that I'm maximizing what my child gets during the time that they're eligible? Because things do change with age, so you want to keep an eye on that, and you want to get them in line. But adult services, as soon as possible, because if they're not in the queue, then they're further back in the line once you do sign them up. So that's something to bear in mind. Sign them up with DDS, have them evaluated, even if they can't get a plan with certain allotted amount of money every year. There's also the issue of there's always extra funding at the end of the year, and if it doesn't get used, it goes back into the state coffers. So you want to tap that as much as possible. Yes, ma'am.
I am the Spanish interpreter for this mother.
Okay.
And she has a question. Her daughter she has Down syndrome. She's 8 years old, and she needs a food support. She called MassHealth, and MassHealth informed her that she has only $200 per year, and which is not enough for the food support.
Like
So-
AFOs that go in your shoe, the foot support, braces.
Para los perritos, porque son flexibles, porque ya casi no camina porque se le voltea mucho la pierna.
She cannot walk well because her legs don't have any stability.
Uh-huh.
And
So, okay, I don't know specifically what MassHealth is telling her with regard to sort of a cap on it, but that would be considered durable medical equipment, because my little one wore them for years. But MassHealth should cover that, and she should be able to get them through Children's Hospital.
Children's Hospital also.
Hold on one second.
Children's Hospital didn't provide that for her either. She went there. ¿Qué pasó con Children's Hospital? Ay, no te lo dieron.
No, pues allá me llamaron y me dijeron que no me podían dar los soportes que porque el seguro no los cubría.
Children's Hospital said that they couldn't provide this food support because the insurance doesn't cover it. MassHealth doesn't cover it.
I can't, what I would tell you is this, is that when MassHealth makes any decision, you have the right to appeal. Okay, so the issue of the braces is, you have to get a prescription for it. And then because it's medically necessary, and the doctor should write a letter saying that it's medically necessary, and then maybe she could get a waiver. So, because I mean,
So she needs to submit
call MassHealth and tell them she wants to appeal, or find out what her rights are if they're not covering something specific. So, that's another thing with MassHealth, is that, so, I don't mind sharing personal information, my husband might, but he's not here, so. My little girl is significantly impacted, so she's 15 years old, she's not toilet trained, okay? But we have Blue Cross through his insurance, and then we have MassHealth as a supplement, she has a lot of needs. So we pay a premium for MassHealth, in addition to the regular insurance, but through MassHealth, we get pull-ups delivered to our door every month, but not everybody knows about this service, so that's why I'm telling you here. They'll deliver the pull-ups to your door and also the pads that go on the bed, so if your child's not toilet trained, You're not going to BJ's or Shop and Shop or whatever and buying the pull-ups. You can say you know that, but there's a lot of people that don't know that, and I don't know about everybody else. But the best information I ever found out when I had a handicapped child was from other mothers. That had already been through the process before, no offense, Gads, you too, but, you know, it was, that's who's gonna give it to you straight up. What do you need to know? What do you need to do? Because there is no, our kids do not come with a handbook to say, have a handicapped child, these are all the steps that you need to take. It's a huge maze out there. None of it's easy. It's a million different phone calls, but it's also perseverance. Perseverance will get you what you need to get, and you just need to know what you're eligible for. And, you know, that's why the information on the website, there's different websites on here for you to contact. There's phone numbers. It's one of those, I can't tell you exactly what each individual child is going to be entitled to, but I can give you all the tools to find out what your child's entitled to, and then you need to follow up and access as much as you feel that you need. Yes, ma'am.
One of the things that my child wasn't, so I know a lot of our children can go and they can apply for the ride.
Yes.
They will be eligible for the ride, and these kids are gonna have to get to work, so we can free ourselves up. The ride will pick them up at the door and take them to wherever it is they need to go. So I've got my daughter at, and she can go out and explore activities. So that's another thing that she can go.
Yeah, and anybody else, throw them up if you know more things you don't know. Regina? Oh, here's our school committee member, Miss Regina Robinson.
I also learned that with the PCAs, a family member who's not a parent can be hired to be the PCA.
My mother's my PCA. Nana does it, you know, so.
In the family, and it really has helped in the older.
Same with adult foster care, when they get old, you know.
When they're at the age to have a part-time job, they can use the PCA, so then that encourages the sibling relationship that could outlive you.
And obviously, SSI is something you want to be looking into. If your child's not eligible to be working, they're disabled, they're registered for MassHealth, that's sort of part of the process. If they're eligible for MassHealth, that means they're pretty much eligible for Medicaid unless there's something odd going on with the situation. You want to get them signed up to SSI as soon as they're eligible. On their 18th birthday, you want to be at the Social Security office signing up for SSI. As an adult. As an adult, not as a child.
Oh, really?
Certain children can get it depending on family income, their disability. That's a separate issue. We're talking about SSI for your child, where the check is for your child. Yeah.
I just wanted to add that if you have, I have a child in a residential program, and she's 13, and she gets Social Security. So if you're in your child's in residential, nobody tells you this, but they're able to get, you petition for it, and they won't get as much as the Social Security amount, because what the government takes is the food and shelter out of it, but they still get a check.
Still something.
I
Still
have
something.
a question. It's like my son's already on SSI, so
Okay.
but I'm his payee. So when he gets 18, does it still go on?
Well, it would be a difference between a child benefit and an adult benefit, and you'd have to talk to Social Security about that, whether or not you are designated legally as the payee. You know, there are all different intricacies to each one, but, you know, Social Security knows the answer to that. I don't,
And
because I haven't
also,
crossed that
for
bridge
this
yet.
adult foster parent program, that's what I was talking about.
Yeah.
Like, what is that about exactly?
I don't have that much information about it yet, but I've heard about it, so we'll find out more information and we'll put it up on the website. Yes, ma'am.
Is your child allowed to have a savings account? And if so, how much money?
So one of the things that Dawn brought up briefly is, because it's not in effect yet, but it's coming into effect, is a new law. It's called the ABLE law, which allows your child for you to put money away for your child and for that not to go against their Social Security benefits. So the laws are actually catching up to the population that actually exists in this world. So they're starting to develop things that, you know, our kids need, and it's not going to penalize them. Like, that's always one of the things I would say is, you know, someone would say, well, I want to give Mary whatever, and I'm like, wait a minute, I don't know how much she's allowed to have in an account before she becomes ineligible for other stuff, you know what I mean? So that's something that you want to, depending on your child's age, you're looking at, you know, when they're a child, they're okay. Well, when they become an adult, the amount of money that's in their name individually can impact their eligibility for services. So you want to talk to DDS about that, you want to talk to Social Security, And when they go to work, if they, if they get like a little part-time job, you wanna make sure that you know how much they can earn before it starts knocking down their social security.
Right
Because
now, I
there's,
believe it's 2,000.
yeah,
that's what I thought.
I know.
2,000 a month?
No, a year.
No, 2,000.
Yes, ma'am?
Yes, again, I am the Spanish interpreter for
Right.
this mother.
Yep.
And these two ladies, they have a question regarding to a voicemail that was left at home by the school regarding to an after-school program by MassHealth. Is that?
O la escuela.
Yeah. Is that, does MassHealth has an after-school program?
No, is Cindy still in? Oh, does anyone know about MassHealth offering a after-school program in BPS?
No, I heard about DDS offering one.
Where, ma'am? Where?
The school?
Yeah, what school?
¿Dónde?
East Boston, la mía va la Kennedy School.
Kennedy School
The
in East
Kennedy
Boston.
School in East Boston?
And I think that's
Jackson.
stepping stone, I think it's something else.
Jacksonville in Brighton,
Well, yeah,
and Humana School.
yeah, we'll have to look into that, so, we can follow up, they just have to, do we have issue forms tonight? Maybe somewhere. John, do you have any issue forms with you?
Website's always better. No, it's fine. I have them.
They're Spanish speaking.
Oh, that's fine.
And also, this mom, she has a child with Down syndrome, and she wants to know why at the school, if you can answer that question, the girl received only 2 hours of classes a day
Yeah.
per dollar.
Okay, so she needs to go and talk to someone at BPS, and you might need to go with her to interpret. So Sandy, one of the questions was, is MassHealth offering, they got a voicemail saying MassHealth was offering an after-school program over at the Kennedy?
At the Kennedy.
Yeah, the Kennedy School.
Kennedy?
Yeah. Okay, I don't know anything about it. I can definitely, if I can take your contact info, I can find out some information and
Yeah.
get you tomorrow.
Okay.
That-
You want them to fill this out?
Yes.
Yeah, just your information will be
And
perfect.
this mom right here, she needs to talk to someone because she has an 8-year-old and she's saying she's getting 2 hours of services.
No.
Oh, this one, okay.
2 hours of service.
So it would depend on age and stuff, but BPS is here, so she should go and talk to one of them. Yes, absolutely.
Okay,
And-
thank you.
Okay, so anybody else have any tidbits of information they want to share, parent to parent? Yes, ma'am. So PCA services, if you have MassHealth, yeah, you can call, yeah, if you have MassHealth, that's how you get PCA services.
1-800-359-359.
Actually, the woman was gonna come tonight from the PCA services, but she had to cancel, so we can put that information up on the website too.
So 1-800.
Personal care attendant. So basically, the parent hires somebody to work with their child,
7570.
fill out the timesheet, and the check goes directly to the person. It's not a lot of money, but every little bit helps.
$13 an
my
hour.
opinion.
I already have hours.
All right, thank you all for coming this evening.
Hello, everybody. My name is John Santamano, the Vice Chair of Boston SpedPac. Thanks for coming tonight. I just want to let you know that we're recording this, so if you missed anything and want to go back and watch it, you can. And then all the documents that are here tonight and additional ones are already on the website. And there's a page under the library called Accessing Services Post-BPS or After BPS. So they're already up on the website and they're live. The only problem right now is that they're PDFs, so they're not translatable, but we'll work on that too as we get going forward. So, next is Carolyn.